And we're live in 5, 4, 3, 2. Even as America begins to reopen, people across city neighborhoods continue to express appreciation for healthcare workers braving hospitals to treat patients with COVID-19. Similar to the firefighters who sacrificed their lives during 9/11, frontline healthcare workers have become the symbolic heroes of the moment. But for many American healthcare providers, this time is unprecedented in terms of the ways in which their lives are threatened. Nurses expressed appreciation regarding community responses, but also felt a lot of stigma as potential disease carriers. The public kept saying, "Oh, nurses are heroes, doctors are heroes, they're doing so much for us." You're out in scrubs and they're contaminated. Get them away, they're infectious. We keep indoors. When we dare to venture out, we are cautious. Our neighbors smile, but in their eyes is reserve and suspicion. They keep their distance as we do ours, in mute accord. As a new strain of COVID-19 emerges, I suspect a new wave of hospital appreciation will also emerge. However, we only seem to appreciate our healthcare workers when we're most in need of them. However, this is unfair because healthcare workers spend their entire lives, years of school and hard work just to take care of us. And as COVID-19 continues to rise in many places, it's important that we take the struggles healthcare workers face during this time seriously. Because this is not to be laughed off or made to be a conspiracy theory. These are real people suffering real tragedies. Articles from NCIB, the Washington Post, the New York Times, and The Intelligencer's Diary of a Hospital are woven with poems found on articles in CNN to create a program dedicated to all of our healthcare workers, because their stories deserve to be told. From the moment he wakes up, Peter Shearer, the chief medical officer at Mount Sinai Hospital in Brooklyn, spends his day thinking about coronavirus. Like every other hospital in the city, Shearer's ER and ICU are now inundated with COVID-positive patients. Shearer knows this is only the beginning, and so he and his Mount Sinai colleagues have agreed to keep us updated on life inside the hospital. This is the first dispatch. The number of very sick COVID patients coming in is scary. We have 220 beds, and we've planned for a surge of up to 240 to 260. And they're sick. The patients are so sick. We probably have 5 COVID deaths a day, sometimes more. It was a pretty sudden ramp up with increasing numbers of patients. They were getting sick and they were getting admitted, and then the beds were filling up, and then patients were just crashing on the floor. Let me pull up my mortality report from yesterday. I haven't seen it yet. So, 10 people died yesterday. So much for that 5 a day. You know, I've cried in stairwells and hallways. Life is fragile, and it could be anybody. It could be any of us. There are days I'm convinced I'm gonna get it and I'm gonna die, but I think those are a little more emotional than scientific. We started putting bodies in the morgue truck last week. I think there's about 40 bodies in there now. You know, we had to outfit it with shelves because you have to make sure that the right families get the right bodies back. I have a COVID positive 41-year-old patient who just died about 5 minutes ago. I got the message. You know, I don't know how long I can keep doing this. In my mind, I'm gonna do it. I'm gonna be here till the end, but it's gonna be real hard to come back to work after this is all over. Much of our fear is unspoken, for there is at last the weight of custom, the tender of rote consolation. We endure thoughts of demise and measure the distance of death. Death, too, wears a mask. Mark Ayub remembers the woman in her 50s who came into the emergency room. Ayub, a resident at Elmhurst Hospital in Queens, tried to reach her family, but when he connected with her daughter, he had only bad news. As he stood in his spacesuit of protective gear, holding his phone in front of the woman's face so her daughter might see her one last time, Ayub was indignant that this is what death had become. He could not help but overhear, "Mommy, Mommy, please. Please come back." Alex Incompang is an ICU nurse based in Texas who came to New York to volunteer during the COVID crisis. As an Army veteran, Incompang is used to dealing with trauma, but she had never experienced anything quite like this. Her dispatch. There was one really bad day, April 12th. We were trying to keep this one patient alive who'd been dying all night. And she was coding. We made it a short code to not be cruel. Then a next door neighbor coded, and I run in and I start taking over chest compressions. And in the hospital, they'll bring in a tripod and then set up an iPad on it so that patients can talk to the families. Well, when I ran in, I knocked over the tripod and it to where it fell facing the wall, but eventually the doctor calls the code. Time of death. I walk back around and I see the iPad on the floor. And I realize that the family's still on there. Shit. They're still on. I hand the doctor the iPad. He goes over and gives them the bad news. And I just hear them screaming and wailing over FaceTime. When I go into these rooms, I'm thinking to myself, am I the last face that these patients are seeing? You know, I'm sorry, it's me. I found myself asking God to forgive me. I shouldn't be the last face that they see. The worst night we had was in the emergency room. I helped intubate one patient, and I look to my left and I see this woman. And she's curled up, and God, I can hear her breathing. Hey, she's next. I go to the head of her bed and I'm getting ready and I'm just taken aback because she has these stunning blue eyes. And I'm thinking to myself, she's looking at me and I'm looking at her, and this is it. Her eyes should have been looking at her husband or kids. I intubated her and she didn't make it. I don't want to play God. I I thought my job as a physician was to do no harm. We can determine who we are in our central nature and who we can be. We are committed to this end for our own sake and for the sake of those who will come after us. There is a better future, and we can secure it. Let us take up the task, and let us be worthy of our best destiny.